Hi and welcome to our update film from Sam Sherrington and
David Elcock.
We're just going to give you an overview of what's been happening across Future Focus Finance in the last few months.
Okay, so we'll start with the best possible value, and there's a lot of work been going on in this area, focusing on the 4 broad categories of decision making that we're looking at. So that's allocation, service delivery, investment and disinvestment, and innovation and risk. We've employed a company called Bain to help us with this. We've also taken on a lady called Ruth Small who will be working with us, and we're hoping to get our first practical guides out to you by the end of December this year. Turning to efficient systems and processes, again lots of work happening in this area, working with our colleagues from MV Consulting and from Ernst & Young, and the maturity matrix is now being drafted, and we're hoping that will be ready and out to you for testing by the end of November, and then we'll move on from there into the actual delivery model around moving towards the best practice identified in the model.
Okay, so close partnering, the group have identified to look at the Don Berwick work, which is about reducing waste as their overall aim, concentrating specifically on the reduction of overtreatment and failures in care delivery which result in harm. The 360-degree feedback, the team are working with King's Fund and Ipsos Mori to look at a national survey which also includes a local self-assessment tool, and also with patient and public focus groups to get a triangulation of measures and understanding of the engagement across. And we've also set up an educational oversight board which includes a number of the existing training providers, and this has been established to consult on the new finance educator role, which will formalise the internal finance training for clinical colleagues and others.
Okay, so turning to skills and strengths, we're currently researching existing skills and competency frameworks that we know are out there. We're looking within the NHS and with external partners, including Network Rail and Shell, and doing some good work with SEMA in that area. We're hoping that the content of the framework will be derived from the work from the other action areas. So we're looking at some key things around that, which include information being online, being easy to access, focusing on the-job learning, and a number of other control issues as well.
So, Great Place to Work. The Great Place to Work has 11 work streams within it, and the team are discussing their alignment with the Harvard Business Review paper, which is called Creating the Best Workplace on Earth. The organisations that took part in the pilot, which we work with Great Place to Work Institute, and their team assessments are currently reviewing their results with their teams, and the CIPFA are preparing to present their independent evaluation of the findings to our Finance Leadership Council. We're delighted to say that over 150 finance directors and CFOs have signed their declarations, and those are all on our FFF Communication Hub website, and with pictures, and we'll be following up with those 150 about their actions and implementation. We've partnered with Deloitte to look at a delivery of a programme called Aspirant FDs, and we'll be piloting this in London in the new year, and with London and the South, with the aims to develop the next generation of finance directors. The career models and enabling mobility is very exciting, and we're working together to launch a pilot scheme around mobility, and this will allow job swaps, secondments and career progression with wider engagement across the NHS sectors. So the last action area is Foundations for Sustained Improvement. The value makers have been making great progress across the country, over 100 value makers, and they began to lead various projects, including the social media training, doing publications and engagement events locally and nationally. We're delighted that a number of value makers will be coming to the annual conference this year. Progress has been made with the Health Business Foundation, and this will provide the infrastructure and resources for the work for Future Focus Finance to embed. And lastly, we are working as a team with We Nurses to build our communications systems so that they are fit for future purposes. And that's it.
Okay, so thanks so much for all your support so far. Any of these things particularly interest you, then contact us for more detail or look on the website to find out more information. Thank you very much.